Good morning and welcome to this week's edition of NCompass Live. I am your host, Krista Burns, here at the Nebraska Library Commission. NCompass Live is the Commission's weekly online event where we cover a variety of library activities and topics that may be of interest to librarians across the state. We have Commission staff that present on topics, and we have guest speakers as we have today. We do these sessions every Wednesday morning at 10 a.m. Central Time. They are free for anyone to attend. They are also recorded, so if you are unable to join us on Wednesday mornings, you can watch any of our now going on 3 years worth of archive sessions that we have available. We do a mixture of types of things: presentations, book reviews, web tours, training sessions, anything that is maybe we think would be interesting. And we have people that come in, as I said, as guest speakers that we have today. And let me go over here and unmute our speakers. So here we go. Marty, I've unmuted you. You should be able to say hi. And Teresa.
That's great. Hi, Krista, and the rest of our audience. And I have with me Teresa Sullivan. Hello, everyone.
Yeah, hi. Today, as you can see from our slide here, Teresa and Marty are going to talk to us about the new website, I guess it's the newish website, Network of Care. I've been exploring it actually myself. Lots of great resources on there that librarians can use to help their patrons, whatever they need to do. So would you be ready for me to go over and hand over control to you guys on your side?
We are.
Show your side? Okay, hold on just a sec. I'm going to make you a presenter. And you should be receiving something to accept and show your screen. Yep, there you go. Yep, we see your slides now.
Okay, great.
Yep. All right, go ahead.
All right, well, we'll go ahead and get started. I am Marty McGee. I am the Nebraska coordinator for the National Library of Medicine, and I'm based here at the University of Nebraska Medical Center in the McGugan Library of Medicine. I probably know some of you, but I've listed my contact information here. If any of you have questions afterwards, you're more than welcome to call me, and I do have an 800 number, so would welcome any contact from you. And with me, I have Teresa Sullivan, and I'm going to let Teresa introduce herself.
Hello, everyone. I am Teresa Sullivan. I work with NAMI Nebraska. NAMI is the National Alliance for Mental Illness, and I am the State Connection Coordinator, which is a support group that we have across the state for people with mental illness. And I'm really looking forward to presenting our Network of Care site to you today.
Okay. I'm going to start out by telling you a few things about the National Library of Medicine and some governmental resources that may be useful to you. And then I'm going to turn it over to Teresa, and we're going to have a little conversation about the Network of Care. So I'm going to go ahead and get into that. One of the reasons that we, being the National Library of Medicine, we like to work with what we call community-based organizations, and NAMI Nebraska, of course, is one of those. And because we think we can be better with the sum of our parts than we can be individually. Another good example of this is prior to the time that we put together this webinar, some of you may know Jonah Deppy, who is the director of NAMI Nebraska, and she actually went out to some public libraries in Nebraska and presented this information on the Network of Care. But we were kind of looking for a wider audience, and so we thought, well, gosh, through the Nebraska Library Commission would be a good opportunity, and that way our information can be archived and people can look at it again if they get called away for any reason this morning. So I just want to mention a few sites I am going to talk about very briefly: MedlinePlus.gov, which I hope you know about, the National Institute of Mental Health, which is another institute under the umbrella of the National Institutes of Health, of which the National Library of Medicine is also underneath that umbrella, and the Centers for Disease Control. And then Teresa is going to cover, actually very specifically, the Nebraska part of the National Alliance on Mental Illness, but it's certainly useful for people in other states, particularly if you have some information on that database as well. But there is other more general information too. Well, here's MedlinePlus. Just a couple of things I want to point out: that if you want to get updates by email, you can see down here the arrow on the left down at the bottom, where you can just enter an email address, and then any topics that are related to mental health can be sent to you We have what we call video and cool tools, so there are certain tests there. For example, if you wanted to look at some questions that might be related to depression, for example. We have an A to Z list of topics. I had actually looked for the mental health topic on this one, so this one took me to the mental health, so I'd searched for that initially. You can see related topics that have to do with age, as well as different things like wellness and lifestyle. And here also is a link to mental health. Then at the bottom, you'll see all of these other things that are linked here. So for example, the overviews are linked right here. You'll see latest news, that's linked down here. And after each one of these, there is where this information has appeared. So if someone comes to you in your library and says, oh, I saw an article on Health Day on such and such a day, you'll know that you've hit the target by the day and by that reference. And the other thing I just wanted to point out here is that we do have some resources that are available in other languages. The MedlinePlus site also turns to Spanish. There's an Espanol button on the first page, but we are starting to collect other resources, although obviously we don't have as an extensive set of resources as we do for Spanish. And just a couple of things I wanted to mention with regard to reference interviews. When some of the challenges might be that you might experience that someone might come to you and maybe they're confused, or maybe they're upset, maybe they've gotten a diagnosis on something, or perhaps they're embarrassed about something. So you want to make sure that you are protecting their privacy, of course, as a huge part of this, that there are no unreasonable expectations. Keep your language simple. And actually, this is a huge initiative right now in the medical library world, is we're working a lot with health literacy and trying to get health professionals, as well as people like ourselves who are sharing health information, to speak in plain language. And, you know, don't be a victim of the perception that you know, people who are mentally ill are dangerous. That's a stereotype that certainly isn't true. So really just your best practices: stay calm, you speak softly, give people a little space, don't make promises you can't keep, and that would be true for anyone. And above all, listen. You want to listen to what it is that person is looking for, and it might not be the patients themselves, but it might be a family member who's looking for more information as well. So with the listen in mind, now we're going to listen to Teresa, and she's going to tell us a little bit more about the network of care. So I'm going to change our PowerPoints here, so let me just get hers going. And I will turn it over to Teresa. Okay, Teresa.
All right. This is the home page of the Network of Care. It's networkofcare.org. And as you can see, it's got a comprehensive list of everything from seniors and people with disabilities, mental and behavioral health, kids, health communities.
And I noticed down there at the bottom, it looks like you have different language resources as well.
Yes, we do.
Okay.
Yes, we do.
That's good.
Yes, we do. And so the Nebraska Department of Health and Human Services has compiled, with, I don't know where all the resources came from actually, a database for the state of Nebraska.
And I noticed that, I know we had a couple of people, I think, in our audience from Texas, so Texas is also listed there.
Yes. Both California and Texas have very comprehensive databases. The product was developed in California.
Okay, so not everybody's there, but we're lucky we've got this in Nebraska.
Right.
Then.
We have it in about 21 states.
Okay, very good.
So we selected Nebraska, and Nebraska is divided into regions. And so you would select your region. Region 1 being out here, Scottsbluff in the west. Region 6.
That's where we're located.
That's where we're located.
Okay.
So we selected Region 6. And here's the welcome page. We have search, which you can search by topic, which some of the topics were substance abuse, depression, and so forth, or you can search by keyword.
And you know, something that I think that was the place we were looking at the different topics, and it had things there not just diagnosis of mental illness, but things like employment and that sort of thing.
Absolutely,
as well.
absolutely. As I said, it's a very comprehensive and well thought out database. Down here we have community announcements and nationwide news. In the services, most of the information is divided into these links with little circles by them.
Over on the right there? Yeah.
Yes, over on the right. Services, library, legislate.
Okay.
We're going to start with services, and I searched for L in the service directory, and
so then these were the results that came up, and it looks like it's showing 15 results out of 25. Obviously on our screen we're only showing you a few of those, but
correct, yes.
So it looks like it gives you the title and a phone number contact and where it's located and a little bit about that particular program or that agency.
Yes, it certainly does. You can click more on the bottom and
it will expand.
Article expands.
Good.
The service directory is also, you're able to search by category, and there's everything from addiction recovery, in-home services, military and veteran services, and mental health services and facilities.
So this might be a good place to start if you really don't know a keyword that you're looking for. This can sort of, I call this a tree, so it helps you drill down to the topic that you need to get to.
That's a good way to say it, Marty. Absolutely. You can search by program or agency name. Again, if you know what it starts with, just so you can select the letter and it'll give you everything, like I showed L. It gave us the list of L. And another important thing is over to the left of the screen, we have a link that says Find Services and then Add or Correct Information.
Oh, yes.
So if you were to pull up some information that you knew was outdated or incorrect for whatever reason, you can contact the organization. They will respond to it immediately. I've been very impressed with the response of the help desk.
And that's a really important thing, because that way you know then that what's listed here is current and it's accurate.
Yes.
Yeah.
Yes.
Very good.
Yes. You can search by keyword.
I especially liked the example they gave you here. This one was on counseling, and it says drug and alcohol counseling, but it also includes credit counseling. So I think we have to remember that all of the topics aren't necessarily mental health topics, but they may be issues that are associated with people of many different varieties. So there is additional help here too.
Yeah, exactly. And people with mental illness sometimes do have some credit problems and trouble managing money. Then we have the advanced search, which this will really localize your search and narrow it down so that you can have it by keyword within the city.
And I also like that you could do this one within a zip code and keeping it within a particular radius. So again, if you can't drive too far, or maybe you're limited to the bus system, or you need to walk somewhere, you can limit your information to include just those things within that area.
Yes, ma'am. Our library, which contains more than 30,000 articles, fact sheets, and reports, and these were produced by leading experts and organizations. You can do a keyword search, and again, they have them broken down into topics down towards the bottom.
And I think for this example, you were going to click on key mental health activities.
Yes,
so
key mental health articles. So this gives us everything from mental health conditions to legal issues.
And again, I think this has a wide breadth of coverage. One of the things that I noticed, and again, something else we're involved in with the National Library of Medicine, is emergency preparedness. So again, there might be special considerations if you have folks who have mental illness with regard to emergency preparedness. So again, something else to keep in mind. The other section here that I thought was good that they've included too is one on Medicare.
Yes, yes. The Medicare provides all the links and downloadable resources. It's very helpful. In the library, we have interactive tools, and this is not necessarily for your behavior or mental health. It is more for your physical health. Which health screenings do you need? Are you at risk for a heart attack? They have a symptom checker, which this is the symptom checker. And you can select a male or a female, and it'll change the figure. And you roll your mouse over a part of the body, and it will ask you questions to try to find out what your symptoms are and then give you advice as to what to do.
So I think you've given me a good example, like if you rolled it over your eyes or something and you said you have blurry vision, then it might tell you you need to make an appointment with an eye doctor.
Right.
Yeah.
Yes. So that's just kind of a cool little tool.
It is.
And these are the health topic categories. Again, everything from allergies to workplace health. It's very comprehensive.
Right, and you know, I think the good thing is that they've included some things here that are very much on what I think of as the positive side. So fitness and exercise, you know, things that people can do themselves to help make their situations better. And it's also, you also can see like senior health or men's health, so there are different demographics that are included. And as she said, right down to workplace health, because obviously a lot of us spend a lot of time in our workplace too, and it's important to keep that in mind as you think about your health.
Absolutely. I like the complementary and alternative medicine topic.
Definitely.
That really broadens mental health care.
Exactly. I think the only thing that folks need to keep in mind if they're using complementary and alternative medicine is they just make sure and tell their doctor about it.
Oh, absolutely.
Because there can be interactions. So, for example, we always use the example of St. John's wort, which is can be used for depression, and that's fine. But make sure that you tell your doctor about it because there may be drug interactions with that particular one as well as other complementary and alternative medicine. But just make sure you're transparent about what it is that you're using.
Now this is our legislate section, and it's a bill tracker. And they maintain a list of all state and federal bills that are current in the legislation in this legislative session that we can follow. You can figure out if you need to contact your senator or sign up with the Advocacy network, and they will email you your any action alerts when they're posted.
That's good. And, you know, over here on the left it says live demo. Do you want to say something about that, Teresa?
Yes, that is a live demo of the complete network of care site. Mm-hmm. So what we don't get covered in this webinar, I would recommend everyone go through the live demo. It's very informative and goes in a little, delves in a little deeper into the history of the network of care and how it was developed, and
just gives you more information.
Yeah, gives you more information and different ways to use it.
Good. Yes, because I think a lot of times, you know, we give you exposure to websites, but really you'll become most familiar with them when you go out and try and find things yourselves and watch these kinds of tutorials too.
We've moved down to the links section, and this is, they've broken out the links local, state, and national. Local is broken down by city or regional. State is broken down by topic. And they have a little suggest a link. So if you know of
something that fits into one of these,
exactly,
then that would be, so for example, you know, maybe when we get health literacy going here in Nebraska, that might be a good topic to add here.
That would be a great topic to add there.
Okay.
Yes, absolutely. This is the national links.
Wow, this is I'm just looking down here at the bottom, weatherization and housing. You know, we do think of housing sometimes, but we don't always think of weatherization, and that's probably a big part of anywhere we live.
Absolutely.
Especially in Omaha.
Absolutely.
Or Nebraska, yeah.
Again, we have the emergency preparedness.
Good.
Insurance. Now, there's not a lot of information under the insurance link, as Nebraska doesn't really offer these services, but it is there for in the future when they do. Support and advocacy. These are support groups and advocacy groups for behavioral health clients and their families.
Right, and perhaps not just behavioral health, because I see Alcoholics Anonymous and Alzheimer's. So obviously there are some contacts for groups that are outside of that spectrum, but useful for anyone.
Right, and you can search for a support group over here on the left.
And yeah, okay, good. And it looks like you can suggest a link for that as well.
Absolutely. If you know the support group that you'd like added or a website, please do suggest a link. Let me go back. We have my folder /Wrap.
So this is down at the bottom of those yellow buttons on the right-hand side.
Yes. And Wrap stands for Wellness Recovery Action Plan. So in this, you get to keep you have the opportunity to keep your personal health care records computerized. You log in to get a PHR account or register.
Right, so this is your personal health record, and this is free, right, Teresa?
Absolutely.
Right.
Everything is free.
So a real advantage to doing this is that you can have all your information in one place and you don't have to carry it around with you, but then if you were meeting with a new doctor or something, they could look at perhaps what you'd had done before.
Yes.
Okay.
Yes. They have folders and subfolders. This is contact information, which will say everything there is about me and an emergency contact. And after I filled all that information in, you can come to this page and you can print an emergency card, or you can ask the network of care to send you one, and a laminated card will be sent to you.
And then that would be a good thing to carry on you in the event that you were ever unconscious. Then people could find the fact that you had this information out there.
Yes.
We call in the cloud, so to speak, and they can go get that information and then help you with your issue.
Right. Right. And this is the first page of the Wellness Recovery Action Plan, or the Wrap plan. And the first question is what I'm feeling like when I'm well. And
so that would really help somebody identify what their actual emotions or their physical well-being at a certain point in time when they feel good.
Sure.
And then I would assume another question later on will be what you feel like when you're not well.
That's right.
Yes.
That's right.
Okay.
And then, you know, how do we stay well?
Right.
Is the purpose of the
Right.
plan.
So that you begin to identify those markers in your life that help you cope with things.
Yes.
And it appears to me that this is more than 20-some pages long. So
it's a very comprehensive
yes.
plan.
So it's a great place to really put everything all in one place and help you collect that information.
Yes.
Okay. Well, golly, that's a lot of information, and I know we probably just touched on things, Teresa, but I think you filled in a puzzle piece for me, and I hope we have for some public librarians, and certainly if anybody has any questions, I'm not seeing any in the chat box, but if anybody came up with any or would like to address anything right now, feel free to speak.
Yes. Thank you very much, Marty and Teresa. Yes, if anybody has any questions, go ahead. Questions, comments, anything, you can type them in the questions section there, and we can address those. Also, I just want to let everyone know that these PowerPoint presentations will also be available when we put the recording up. Marty, if you'll email them to me, I will add them when we put up the recording of today's session.
Okay.
And all the links that were mentioned, the network of care itself and the ones that you had on your slides will be linked as well from the recording.
Okay, very good.
So people will have access to those as well.
We can't get much better advertising than that.
Well, I was going to say at the beginning, I never even did get a chance to. The Library Commission is very happy to host any of these kind of sessions that you guys want to do. Get this information out. Definitely great resources for people in the libraries, public libraries, who need to help any of their patrons that are having any sort of either health issues or, as you guys were saying, planning for future possible health issues, that kind of thing.
Yeah.
These people don't have access necessarily at their own homes to anything internet-based, and this is just, great resources here.
Well, and obviously the Nebraska Library Commission is heavily involved in the broadband program, where more libraries are getting better internet access.
Exactly, yeah.
This is a large component of it, is that it will help people stay healthy.
Mm-hmm. Yeah, we are upgrading with our federal grant that we got for the Libraries Broadband Builds Nebraska Communities. Not sure how many libraries now have it, but a bunch of them are getting their internet speed increased. So going to be a lot better access at libraries for resources like this and all sorts of other things, anything you need to do online. We do have a comment, actually, from Dan Neiman, who's from, actually, South Sioux City Public Library here in Nebraska.
Okay.
That he's glad that you have the information on insurance and housing that's in there.
Good.
Some kind of, it was interesting to see also for me the kind of things that are not necessarily what you would think of as health, but then when you think about it, they really do relate to it, like the weather protecting for your house and that kind of stuff. Yes, if you don't have, so think outside the box kind of thing is the kind of stuff that's being put into here.
Exactly.
Mm-hmm. And I think, Marty, you had mentioned something earlier about, something else that was going to be worked on. I can't even remember what it was.
Health literacy?
Yes, the health literacy. Is that something that you guys are doing, or where's that coming out of?
Actually, I'm part of an initiative, but it's I'm involved with some people who are with the College of Public Health here at the University of Nebraska Med Center and some other folks. So we're really just getting off the ground. We don't even have a website yet, but we're hoping that will happen in the next few months here, and that we can find some funding. But our real initiative there is to get the word out that not only do health professionals need to speak to patients in a way that they can understand it, and this is for all patients, of course, but patients have a responsibility to ask their doctor the right questions too. So, for example, what's my condition, and what are you recommending, and what will happen if I don't do what you tell me to do, those sort of things, that we always take responsibility for our own health care as well, but making sure that if we are providing health materials, that we are providing it at a level that people can understand it at. And making sure that we're using simple language, that we're, not having a brochure that's in 8-point print and then giving it to a senior health audience. So, it seems like it's common sense, but, we just need to help people think about it.
It is difficult to deal with that. I know when my grandparents were getting older, my mother would go along with them to their doctor's appointments because they needed some, and she had a notebook she would take notes on whatever the doctor was saying because they were just not capable of comprehending all of this being thrown at them. And especially as people get older, they have multiple doctors they have to visit for various things too.
Yes,
so it can be
all the time. Yeah.
Yes.
Very true.
Cool. So that sounds very, well, hey, whenever you get that done, we'll do a session on that.
Well, we'd be
Absolutely.
happy to do that. I know that it'll be a great avenue for us to get the word out. Okay.
Yeah, doesn't look like any other questions any urgent questions have come in while we've been chatting, and that's fine.
Okay.
So anything else you guys want to add before we wrap up for the morning?
I think that's all from
We're
me.
good?
How about you, Teresa?
Okay.
No, that's all for me.
All right.
Okay, great. Well,
Website.
yes, definitely. Well, thank you very much, both of you, Marty and Teresa. This is a great session. Some really, as you said, great information out there. And definitely go to the website to get more information.
Okay.
Let's see. I'm going to switch back to my screen here.
Yep, there we go.
There we go. I was just browsing the page myself, but yep, here's the website with all the links that we were showing there. And you will have contact information for both Marty and Teresa, as you saw as in those slides. Of course, feel free to call them if you have any questions and want to know more about the site and what's going on with it. Okay, so thank you very much for attending, everyone, and thank you guys for presenting. I hope you will join us next week when our session is next Wednesday about the Gates Foundation Opportunity Online Hardware Grant Program. This is actually not a grant that is available coming up. This is one that libraries in Nebraska have been doing, and the program just wrapped up after 3 years. About 3 years of time, and some of the participants in the grant program are going to share their stories about how it went and what they did with it, just to give some ideas to people of the kind of things that you can get involved in and other grant programs that may be coming up. So that will be our session for NCompass Live next Wednesday. So hope you'll sign up and join us for that. Other than that, since it doesn't look like anything else has come in, I will say thank you and see you next week. Bye-bye.
All right. Bye.
Bye.